Hi, everyone. I'm Dr. Mariam Davtyan. I'm a senior research associate at the LA County USC Maternal Child and Adolescent Center. I wanted to begin by telling you about our clinic first and then go into what type of research I conduct at the MCA clinic. So the Maternal Child and Adolescent Center for Infectious Disease and Virology, or as it's known, BMCA Center at the LA County USC Medical Center, is a state-of-the-art family-centered model of care, combining primary care, tertiary care, and research for disenfranchised and traditionally hard-to-reach HIV-positive populations. The MCA Center's unique comprehensive one-stop model of care enables women, men, children, and adolescents to receive a continuum of primary care with specialty care services, including medical evaluation and clinical care, psychosocial support services, adherence counseling, and nutritional counseling. So I've been at the MCA Center for 15 years, and a chunk of my research has been looking at the impact of antiretroviral medications on children. But since 2012, my research has shifted to focus more on HIV-related stigma and discrimination. So there have been a lot of advances in the management of HIV. It was once a death sentence, but it is no longer a death sentence. It's a chronic condition, and a lot has changed. We have very effective medications that give patients living with HIV a chance to live long lives. But what has remained challenging is the stigma that is associated with living with HIV and having HIV, and that's something that hasn't really changed too much. So stigma is an incredibly harmful social phenomenon, and it has quite alarming and deleterious consequences on populations living with HIV. The literature says that about 90% of people experience stigma associated with their HIV status, and about that many also internalize the stigma that they experience. And when HIV stigma is internalized, it becomes incorporated into the self-concept, and it begins to alter health-seeking behaviors. And one of those behaviors is adherence to antiretroviral medications. So in order for people living with HIV to live healthy and long lives, they have to adhere very strictly to antiretroviral medications, but stigma deters those plans. And so what we wanted to do is create a very creative way that people could learn, or people living with HIV could learn about how stigma impacts adherence. And so what we did was we recruited patients who have adherence problems from our clinic, and we trained them in this concept called photo voice, which is documentary photography. What we wanted them to critically reflect on their experiences with stigma and discrimination and bring those reflections to life using photography. And through those photographs, we wanted them to really discuss and offer their stories of how stigma has impacted their lives, including their adherence to antiretroviral medications. It was such an incredible project, and what we found was that for many patients, this process of reflection really made them feel better about living with HIV. Talking about their experiences with others in some similar circumstances made it easier. And I think quite a few of them said that they began to develop a more positive thought process about living with HIV when they went through this photo voice sort of transformation and reflection. And many of them changed their thinking in terms of how they wanted to address adherence. And some of them actually were compelled by this process to take their medications. It's unclear how, this project will impact adherence long term, but we know that during this process, our patients were very positively influenced by participation. And so what we have hoped to do is really get people to talk about their barriers and use this sort of experience, this platform to tell their stories in an effort to unearth their feelings, and hopefully those would translate into changes in their adherence to antiretroviral medications.
Hi, everyone. My name is Yeu Q Nguyen, and I'm a multidisciplinary artist working in Los Angeles. I was born in Vietnam, and I immigrated to the US when I was a teenager. In my art practice, I explore the connection between personal memory, cultural heritage, and contemporary social history and events. So in my art practice, I actually combined my training. I was trained as a literary scholar, I also did classical training in media art, primarily figurative drawing and painting. And I'm also currently studying engineering. So in my art practice, I actually combined all of those and kind of self-taught myself sculpture. So my work actually spanned multiple disciplines, lighting design, VR, media art, more traditional sculpture, ceramics, and painting. I've always been very fascinated with science, especially the intersection between science and art. I'm a huge nerd, so I'm really proud of it, actually. I think nerds rule the world. So when I kind of saw the call for an artist and researcher collaboration, I immediately emailed Ted. I was like, sign me up. So I came to the project, and the thing is, I actually did a few pieces on women's rights, particularly in the Me Too movement, pertaining to the Me Too movement. One of those work was actually featured as a cover on LA Art News. And so when I got paired with Mariam and Tony for their research and their clinic with kind of focus on women and children, especially, women dealing with HIV, I kind of felt like it's, in a way, like, oh, okay, this is like kind of part of, what I've been interested in and been working with. So at first I wanted to make, a sculpture and things like that. Unfortunately, due to COVID-19, that we couldn't exhibit things in public. And I wanted to build an interactive sculpture which will require a lot of touching. And so, okay, we have to scratch that. That didn't work. But during the collaboration process, which took us, I think, a few months, right, Mariam, like 2 or 3 months.
Yes.
And we did a lot of visits and talking back and forth. And during that time, usually in my process, I always created sketches, painting, to kind of like, is it my abstract, so as I continue with the design process. And those abstracts eventually became the work that are currently exhibited in the online exhibition. So that's a bit about me and how I got involved with the project. I can go into kind of like how give you a little bit of my interpretation of the artwork. So I think one of the things that really struck me about, and Mariam has touched on this as well, that is the degree of not only social stigma, but also the self-internalized stigma in patients. And that is something that is not only harmful to your mental health, but in these patients' cases in particular, it's endangered their lives as well. because I do have to adhere to a very strict, care treatment schedule. And so actually one of my inspiration when I created these painting was, those very vintage mint, like candy mint boxes, really beautiful drawing, but they really like eye-catching. Because a lot of time, I really do feel like even when I was discussing, with other people about this project, there's like a glazed look over their eyes. Because I think a lot of time when we think of HIV and a lot of like more like sexually transmitted disease, people think, oh, that would never happen to me. So there's a level of kind of distancing because we don't want to like be associated with it in any way. And also it have such a, when like our collective memory of the disease was really shaped by a very stigmatized image back in like the 70s, and which is no longer true. So actually, the reason why I thought of those, like mint, like candy tin containers, was because they were so bright and so colorful, and they really catches your attention. And I was like, I wanted to call more attention to this. And, like mint and candies, originally the idea was also, to make the sculpture into a candy dispenser, to normalize it, so that people can talk about it, have a bit of humor about it. So I just want to show you kind of, so these were created digitally. And so this is what I did was, as Mariam was saying, there was a lot of digital assets in the Photo Voice project. So this photograph was actually taken by one of the patients. What I did was, I'm going to backtrack a little bit. So now I actually did visit the clinic, and then in talking with the patients and also the clinic's pharmacist, I actually really went through how many pills does a patient take each day or in their lifetime, and how long would that be, and how much weight is that in total? And it's an astonishing amount. So some of the pills like this big, it's really hard to swallow, and you have to swallow like that every single day, sometimes more than 1 or 2 pills a day. And over the course of a lifetime, and I made the calculation, it's about 60 to 80 pounds of medication that you will have to take. That's an astonishing amount of medication, and that is not counting all of the other medication you might need to take, for example, for vitamins that you need to take, or some of these medicines have side effects, right? And not mentioning also mental side effects of being labeled as an outcast of society. So actually, the actual amount of medication that a patient needs to take throughout their lifetime is probably double what I've just quoted you. But I did obtain some of the medications, that is expired from the clinics and the patients. And what I did was I kind of arranged these pills into, the shape of a mouth. Now, I wanted to pick the mouth because that is where your voice comes from, right? That's your voice box. That's also where you inject medicine. And of course, there's always, in popular culture, the mouth is always a sexualized, piece of anatomy. So that's why I kind of chose the mouth. And so I, input in Photoshop, I overlay the work from the Photo Voice project into this image. And then I frame them in ornate gold frame. Because one of the things that we touched about when I was talking with the patient was the fact that she felt that she has to be invisible, that she has to hide herself. There's this need to kind of protect this part, of yourself, and it's really hard when she put it that she could never feel like she can be truly 100% herself with another person, because there's always that moment where you need to review, this truth about yourself. And I think that's one of the hardest things. Listening to the stories was the amount of emotional damage that they've received just because that they contracted this disease. And contrary to a lot of, to like popular thinking, it's not due to promiscuous lifestyle. You can get it from birth. Like one of the patients, actually, it was a mistake being made in the kind of blood transfusion that she received, and so she got HIV from that. Another person got infected due to her spouse, and so it's really. And I want to keep in mind that I think Mariam can speak to this better than I can to the science, but they don't have full-blown AIDS. They have HIV positive. So with current treatment, it's very possible they can lead a completely normal life with zero transmission. And so when I make these work and I want to reframe their stories and their accounts of isolation, like feeling of insecurity, feeling of despair, into something that to be celebrated, to take space and to get noticed. My wish really is that that these works, if they exhibit it, when they exhibit it, that they cannot be ignored. And so I chose a very bright, like popping color palette. And that's kind of how I kind of came up with, these paintings.
So one of the things that we wanted to really showcase and highlight is that HIV-related stigma is an incredibly inflammatory phenomenon with devastating consequences. And one really major shared experience is that people feel ashamed. They feel dirty and they feel marked, like it's a mark of disgrace. And as you said, people come from different circumstances, and there's so many erroneous assumptions made about people who live with HIV. And those assumptions don't just, they're not just enacted and then they go away. People are recipients of those assumptions and attitudes, and it really impacts the way they feel about themselves and the rest of the world. And so that is a really big message that we wanted to convey to you. And I think that she did a fantastic job creating these pieces from the photographs that we provided her. And I think that she did hit the mark, and she did understand very well that people with HIV deal with a potentially life-threatening disease, but in addition to that, they deal with the stigma that comes with living with this disease and how much damage that does. And so I think that she grasped the concept really well, and I think that she captured those nuances and those textures very effectively with her art. And we're very thankful and very grateful for her.